Since El Paso Children's opened in February of 2012, our focus has been on the core program building blocks and recruitment of pediatric specialists. El Paso is a dramatically underserved community, but today El Paso Children's is not yet 2 years old, and we have more than tripled the number of pediatric specialists in the community. Part of the reason is that we are the only place in the nation with a new independent four-year medical school, a new children's hospital, a changing university environment, on an international border with unique opportunities for research. An example would be our chief physician, Dr. Bradley Furman. Triple boarded, he is a pediatric intensivist, a pediatric cardiologist, and a neonatologist. He is also an inventor with multiple patents to his name, like the Furman catheter that is used in every pediatric intensive care unit and pediatric ED in the nation. So it has been very exciting for the community that things have moved more quickly than we anticipated. One important area still lacking is pediatric interventional cardiology.
Congenital heart defects are America's #1 birth defect, affecting 1 out of every 100 babies.
In El Paso and the surrounding area, we have a lot of diabetes, including in mothers. That increases the risk for congenital heart disease. Some of these are things that never need any intervention, but most need to be fixed at some point. And the simpler the fix, the better for the baby. I would say at least 2 to 3 out of 10 infants in our newborn intensive care unit at a given point, including today, have some form of congenital heart disease. It may be the major or only problem for the baby. It may be part of a series of other problems.
But there are also many patients who require cardiovascular expertise because they have shock related to infection, trauma that affects their circulatory system, and those patients will benefit from having the additional expertise incorporated into our intensive care programs.
From the pediatric critical care standpoint, is tremendously important. These children are very, very sick. They require continuous attention. They can deteriorate very, very quickly. They are considered to be probably the top highest patients, highest sickest patients in any particular children's hospital at any particular given time, because their heart doesn't work well.
Currently, no hospital in El Paso is performing pediatric heart surgeries.
I think the key to its importance to the community is that El Pasoans have been accustomed to having to leave this city to get specialty care, and especially cardiac care. There has been no capacity in this community to get to do heart operations. For the Children's Hospital, developing a program that will offer that to the people who live here offers to bring new expertise to the hospital, new training to the nurses, new training to the doctors, development of new programs which will involve new jobs for subspecialists who do cardiac intensive care and pediatric cardiology, and it will make the care of other patients who have circulatory problems but don't have congenital heart disease, it will make their care better.
Currently, our kids who need even the most minor pediatric interventional cardiology procedures are being taken out of town to have those procedures done. These are procedures that can be done in town, but we simply don't have the facilities. It's a large volume. It's putting a significant stress on those families. It's making those families take time off of work, move out of town for sometimes a few weeks, because once they have the surgery, they have to stay out of town to recover. And it's a great expense. It's a great financial stress on those families.
The Cardiovascular Surgical Program and Training lays the groundwork for El Paso Children's Hospital to provide state-of-the-art pediatric cardio services, including cardiac surgery program, cardiovascular intensive care unit, cardiomyopathy program, pulmonary hypertension program, electrophysiology program, interventional catheterization program, perinatal program, cardiac anesthesia, and cardiology outpatient services.
Overall is to create a cardiology and cardiac surgery program, and there are several components to that. The most important components, of course, include the cardiologists who perform the interventional procedures, which are minor surgical procedures, and then the second component are the cardiac surgeons who would do the open operations in the operating room. Sometimes kids only need one or the other, but frequently they need both. And more importantly, sometimes a child will start off needing an interventional procedure, but then can turn into an emergent surgery. So what we really need to set up is a suite, a cardiac interventional suite, that is immediately adjacent to a properly equipped cardiac surgery suite.
The presence of a cardiovascular program is just another step into accomplishing the mission that we pledged, several years back. There's other programs that actually continue to be in our aims, to be built. The cardiovascular program is what now makes sense on the future of El Paso Children's Hospital. It's not only that we're going to be able to help a specific population, but having and bringing that edge into the community will add synergy to all the other programs that we have. So all the other programs will benefit directly from having, this particular program, these particular patients.
While ECMO is necessary for pediatric cardiovascular surgery, it also plays a critical role in pediatric emergency medicine and neonatal intensive care. Neonates remain on the ECMO machine until their own heart and/or lungs can resume normal functioning. The same ECMO required for the pediatric cardiology program also benefits the preemies in the neonatal intensive care unit,
which is essentially a heart-lung machine without the heart pumping part. And that's really needed for babies and children who are critically ill, have failure of their respiratory system, their lungs, still have some heart function, and they need time in order to recuperate the problem in their lungs. ECMO is also goes along with a cardiac program because it can be a bridge to and from surgery.
Currently, no hospital in El Paso offers ECMO. In collaboration with the Paul L. Foster School of Medicine, El Paso Children's Hospital will become a leader in training pediatric cardiologists of tomorrow, with three-year pediatric cardiology fellowships.
Brilliant individuals on the faculty coming to the Children's Hospital is that the pediatric residency program is going to be strengthened even further. You're going to get top-notch pediatric residents training in our program. It's just a dream come true.
There are very few centers in Texas that offer children's heart surgery, and they're all very far apart. And we are strategically located geographically to be one of those referral centers. So we need to be one of those referral centers. There's a large area of West Texas that's not served by good pediatric heart surgery. And so once we put these elements in place, we can serve that large area. And those people won't have to travel as far as they do now.
All the initial elements are in place. We'll go through a training phase. We'll be sending nurses and perhaps doctors away to get some additional training, and then bringing teams here to do some on-site training, bring in the equipment to set this up, prepare the pump team for the open heart procedures, get the intensive care unit ready for it, and the total rollout time for that is probably 6 to 9 months once it's completely funded, because the children really are entitled to this kind of care, and we can develop those programs. We will not be able to develop them without philanthropic support.
We have structured a rollout with one of the leading pediatric cardiothoracic surgeons in the nation. Our foundation has made it their focus to help us achieve this objective. To be a top-tier pediatric hospital and to better serve the children of the El Paso region, a pediatric interventional cardiology program is needed. Currently, approximately 250 children a year must travel from here to East Texas or Arizona for this kind of care. Pediatric interventional cardiology is the next big building block for El Paso Children's.